Hello, our viewers in Nigeria, Africa, and around the world. Good evening once again, and welcome to Talking Health with Dr. Laz, your favorite health program on television. My name is Dr. Laz Eze. You know, this 2021, and we are still battling with pandemic COVID-19, which has stretched our healthcare system very much. And of course, not just the healthcare system of Nigeria or other countries in Africa, but the entire globe. So there's been a lot of reports, especially in Africa. Let me mention Lagos, let me mention Abuja, and many other cities around the continent where there's lack of oxygen, there's lack of ventilators, there is many people with other health conditions are being asked to go back. You know, health facilities are overstretched. And a lot of conversation has been going to what possible solutions could be, you know, given that even citizens or the people are also being scared of going to seek health care because of the congestion all over the place. Of course, the solutions are not far-fetched because over 5 decades ago, telemedicine has started around various parts of the world. You know, of course, telemedicine speaks to the use of technology to connect persons in different locations or even within the same location to improve access to care. In Nigeria, especially in 2007, the National Space Research and Development Agency and the Federal Ministry of Health came together to do pilots in 2 federal university teaching hospitals, especially University College Hospital in Ibadan and University of Maiduguri Teaching Hospital in Maiduguri, as well as 6 federal medical centers. And of course, a couple of private hospitals joined that pilot project to test run telemedicine in Nigeria. So there's been a lot of talk about technology. This is 21st century, and technology plays a lot of role in every aspect of our development and our national life. So it's not surprising that discussions around using technology to improve healthcare, you know, has heightened, especially since the second wave of COVID-19, which has been more devastating and, of course, affecting many persons in Nigeria, Africa, and around the world. So today, I'm going to be having conversation with 2 experts. You know, one is a doctor of physical therapy, and the other is, you know, who I would describe as a tech guru. I'll be introducing them further after the break. But before then, don't forget to follow us on our social media handles, displayed right there on your screen, and subscribe to our YouTube channel so that you can always get to watch the program as many times as possible as you want. So when we come back from the break, we are going to get proper into how health meets tech. Please stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Before the break, I told you I have 2 guests who will be joining me today as we discuss how we can leverage on technology to enhance access to quality healthcare, not only in Nigeria, but the rest of the world, as we continue to battle with the COVID-19 pandemic, you know, which has, you know, come in very full force in recent past weeks. So with me in the studio is Dr. Joseph Olowe. He has over 30 years experience as a physical therapist. He's based in the United States, and he's also the Chief Executive Officer of Josmol Group. You're welcome to the program.
Thank you for having me, Dr. Laz.
And joining us via Zoom from the United Kingdom is Mr. Tony Amadi. He's I describe him as tech guru. He's the founder of Kwikam App, a mobile application, and also the ICT Lead for the Make Our Hospital Work campaign here in Nigeria. You're welcome to the program, Mr. Tony.
It's a pleasure having me, Dr. Laz.
Thank you. So let's quickly get into the discussion. Let me start with you, Tony. In recent past, because of the effects of COVID-19 on the healthcare system in many countries in the world has been overstretched, and of course the need for minimal contacts among persons, the conversation around the use of technology and tech-based solutions has become very topical. So we now have a lot of use of the languages like e-health, mobile health, telemedicine, health technology, mobile technology, so many other languages. So could you kindly describe what this actually means?
Okay, thank you, Dr. Laz. Actually, the names talks about the application of technology in enhancing health. Okay,
Okay.
of course, these days you could make call to your doctor, all right, describing what your problems are. This is part of the use of technology. Now, basically, the names you've called, the e-health, the m-health, the telemedicine, and all of that, explores or tries to use the availability of the telecommunications, information, and all sorts of communication devices you have, such as your telephone, such as your PDAs, that's personal digital assistants, such as the internet, and of course, wearable devices and all of these. It's used in enhancing health and making it possible for people to access, health or medical assistance when the need arises. Is actually referring to the telemedicine, the e-health, and the mobile health.
Okay. Thanks for that. I was about to ask, but I think you partially answered that. The kind of technologies that are available for use in the health sector. So you've mentioned the mobile phone, the internet, and some others. So thank you. Let me come to Dr. Joseph Olowe. Telemedicine has been in existence for more than 5 decades.
Yes.
Especially in developed countries. But especially it was in 2007 that Nigerian government formally introduced it. But not so much progress have been made. So it was started in UCH. I was a medical student in 2007 when it was launched. I was in my final year, and it sounded very interesting. So I was feeling that 13 years down the line, we would have made huge progress. But perhaps it could be considered as one of the positives of COVID-19.
Yes.
There appears to be more uptake. So what opportunities and benefits does telemedicine present to the Nigeria or Sub-Saharan Africa in the health sector, and how can we take advantage of these opportunities and benefits?
Thank you, Dr. Laz. Telemedicine is not here to take away the conventional medicine. So I think let's just start that so that we can allay the fear of people that robot is going to take over your doctors. No, it is actually making life easy for the patient and for the doctor. Okay. Well, the ratio of doctors to patient, even in the developed countries, in the countries like US, is about ratio 1 to 357. In Nigeria, we're looking at ratio 1 to about 2,500 to 3,000, which is
1 to 6,000.
1 to 6,000. So I've been corrected. So
and WHO says 1 to 600.
Okay. So now we are on the negative side. So what telemedicine does is it can put one doctor into so many homes at the same time. So one doctor in one place can see only 20 patients. 30 patients. One doctor on telemedicine can double the number of patients that can be seen. So that makes telemedicine more accessible, more affordable. More importantly, NCC tells us that even Nigeria have over 150 million internet subscribers. So it is time, even we might not have had a lot of progress. Like you said, COVID-19 has brought this to the forefront, and I think it's time for us to leverage and help our doctor reduce the stress on our healthcare system.
Okay, so Dr. Olowe, I've seen you say to make health care more accessible, more affordable.
Absolutely.
Perhaps more available.
Exactly.
Right. So are there some specific examples you could provide, especially with the situation we found ourselves? Apart from those that have COVID-19, you still have people with cancer, we still have people with
high blood pressure,
heart disease, diabetes,
absolutely,
asthma, and so many other health conditions. So
anything that can be seen at a regular doctor's office can be seen on telemedicine. Actually, telemedicine is evolving so much that there are other applications that at the comfort of your home, you might be able to get all the vital information that is needed for the doctors to make a clinical decision, uploaded into the application, and the doctor can see those information real life. I mean,
Okay.
this is
So
happening.
breaking it down,
Yes.
I'd like us to be practical.
Yes.
So let's take, which hospital will you want to take? Say Luth, Lagos University Teaching
Let's
Hospital.
go there.
So let's say someone in Kafanchan, you know, in a general hospital, send something to someone at Lutz, perhaps a consultant,
Yes.
right?
Yes.
You know, so about a patient.
Yes.
They could use technology to provide. So you may want to take it up from
Absolutely. Even if you can even talk to a doctor in UK.
there. Okay.
Look, you want a second opinion or you want to know more about a condition, a doctor in Lut can be talking to a patient and they can even bring a doctor in from the UK through telemedicine to enhance that diagnosis. Instead of you picking up your bag, buying a ticket of 1 million naira, flying to UK, you can solve that problem now with technology in telemedicine. Actually, the world is no longer, the world is a village now, which means I can leave my room right here and step into United States or United Kingdom and talk to a doctor as if we are talking face to face. It's going to make, that is where the affordability is coming from. Instead of you packing your bag, getting a visa, doing all of that, you can get the same second opinion for 1,000 naira, whatever. I think I can make a bold prediction that in the next 2 or 3 years, we're going to have in our colleges digital medicine training.
Okay.
Because it's going to become so part of us. You know, people like Google says, if you have a business or you have a application and you don't have a digital strategy, at least 50% of your operation, you are no longer going to be relevant.
Right. So let me come back to Mr. Amadi. Not every community in Nigeria, West Africa, or in fact around the world have access to mobile telecommunications or any form of internet. So those ones might be worried if they are watching this program that all these we are talking about appears to be internet-based, appears to be those that have Android phones or those in any form of connection. So is there a way that perhaps those who are in locations where they don't have access to this, can they still benefit from telemedicine or use of technology in improving healthcare?
Yes, Dr. Khan, you know, just recently there has been this wave around the use of drones, you know, in delivering health needs. People use drones, you know, where, well, maybe there is urgent need, okay, for mediation. They use drone to send medical facilities. People could as well use drones to take samples, you know, and deliver, which makes it faster. Okay. Now, there are other applications like the Kwikam we have developed, okay? What it does is it gives you access to health or rather hospitals, you know, close to you or emergency units close to you at every instant. It is based on GPS technology, you know, which doesn't really need you to have an internet for it to work. These are perhaps one of the areas where technology can actually enhance health, because sometimes these people might not have access to the hospital, but they could use to get, you know, hospitals hospitals contact to call and probably get help. Okay. Now, although you had said, I mean, in my first reaction, there are actually several technologies that are, I mean, telemedicine that are enhancing telemedicine or has been brought into telemedicine, which I didn't have the opportunity to talk about in the first reaction.
So okay. Yeah, you are going to talk more about that when we come back. What I get from what you just said is, yes, even for those where there is no telecom, but they still need to have a smartphone to have an app, you know, but perhaps whether there is connection or not, they will be able to use some mobile apps like the ones you mentioned. So we're going to take a break. When we come back, we'll continue the conversation. Do stay with us. welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, before the break, I stopped Mr. Tony Amadi, who was talking about other solutions. So please, could you quickly talk about them? And of course, when you're talking, please have Nigeria in mind, have Africa in mind, so that you'll be able to provide context, specifics, either on individual level or institutional levels.
Okay, Doc. Yeah, I was to talk about the other areas where technology is being, the other variations, where technology has always, has gone into helping. People, before now, it's been a kind of big discussion talking about the availability of people's medical information. Okay. Data and all in the data bank. There has been this issue of, having it leaked or accessed by unauthorized personnel for personal gains. But now there is the use of blockchain. Blockchain is actually a crypto-oriented technology that is used to, cipher, make information so readable. You understand?
So is anybody using it in Nigeria?
Yeah, it could be used in Nigeria. When before we could actually talk about how it could be used in Nigeria.
Okay.
One of the challenges we have in Nigeria is wrong administration of drugs. Let's take, for example, there is an accident on our highway. The victim is unconscious, but may have underlying healthcare issues. That a wrong administration of a drug could become so dangerous at that time. Nothing stops us from having access to the medical reports online. Do you understand? So that's where the blockchain comes in. Keep this information unaccessible to the wrong people. Maybe you could use biometrics to access his own medical records and all of this. So blockchain should be looked at as well.
Yes, blockchain technology. Yes, I know when it comes to data collection, the Nigeria already uses for about a decade or even more than that. The DHIS, District Health Information System, DHIS2, is the national data, health database. The Federal Ministry of Health is using in Nigeria, and also some health projects, also have some level of mobile applications that or softwares they use to collect data. But I get what you're saying. To ensure safety of those data, we may have to consider the blockchain technology. So I'll get back to you before we conclude. Dr. Olowe, there's been some persons who feel there are a lot of equipment around the place that they could use to, right now you can check your blood sugar just with a strip and a small drop of blood. There are a lot of strips that is being used to check for malaria, the rapid diagnostic test kit, for HIV as well, persons with different kind of health conditions. So do you think there could be a way where people in their home could have those tests, get an explanation, and get to speak with someone? Are those technologies available? Are they here in Nigeria?
Of course.
Or where else in the world? How well can we get to use them to help our people?
Of course. Look, there are so many companies out there in the telemedicine space. One of them is Dr. Connect. These kind of technologies are available with them. EcoMed, which is a public telemedicine platform for Lagos State, that are there. These companies, they have this technology that you can sit at the comfort of your home, you can get your blood sugar, you can do your EKG, which is an ECG, you can take your temperature. This day and age, the COVID age, that you need to know the oxygen level of your blood, you can do that, and they can do your blood pressure.
So who will help you to interpret it?
There's a doctor.
Do you have to go to a health facility to get that interpreted?
Once you get all this information through this application, you can upload it into the system, and there will be a doctor on the other side, real time, looking at those information and telling you, Dr. Laz, your blood pressure is a little bit high today. Go over your medication. And if they need to adjust the medication, they adjust it. If they need to adjust the medication, they will tell you, Dr. Laz, I'll see you
So
in.
is the government of Nigeria considering using this? If you know, do you know, if you mentioned the example of Lagos state government, they have
Correct.
something like that.
Yes.
Do you know any other governments at the sub-national? Is this something you want to recommend at the national level or other states to
Yes,
implement?
yes. Our government should work with our National Nigeria Medical Association to actually look into this telemedicine thing and enhance this. There's a lot of private organizations that are doing this on their own, but I'm sure the time is now in order for us to roll it out and make it better, even more affordable and cheaper, if the government can make it a national project and help the Nigerian populace at large.
Okay, it's exciting to know when it comes to government, the tier of government that have most responsibility around there is actually the state government. The federal government does more of policy, development, and coordination, monitoring, and evaluation. But most of the hospitals in Nigeria, whether if it's government hospital, general hospitals is the state government that own most of them. The primary health care have been domiciled on the state government through the primary healthcare development agencies.
Yes.
You know, so it will actually be great if because different states have their own dynamics. You know, so for them to consider these technologies, especially as COVID-19 has further stretched the health workers around the country. Going back to you, Tony, when we talk about technology, some might want to ask, do we have the sufficient infrastructure? Sometimes even to make a video call is problematic. WhatsApp video call, you'll be struggling to, there is, say, 2G, 3G, and all of that, and 4G. You know, so do you think Nigeria has the sufficient health tech infrastructure to make this work seamlessly? Or if you think what does the government of Nigeria need to do to optimize this?
The answer is as good as the question. It is actually no. We are far from this system that could give us the desired healthcare infrastructure. One, if you look at our hospitals, the health care, and that's probably what, sorry, not just probably, but one of the reasons for the NGOs and campaigns like Make Our Hospital Work, it is because it is not working. You can't have a hospital that is below standard, you know, and you talk about, you use it to reference, as an infrastructure. It is absolutely abysmal.
Yes,
no.
we have a couple of minutes to round up. Yes, I wanted to speak to that very quickly. What should government do to optimize our tech infrastructure?
Okay, now, you know, health is actually the second option we have to life. Health helps us attain, you know, the medical sector now brings life into us when it starts failing. Now, the government can actually, you know, take the funding of the healthcare sector seriously. You know, it should be taken seriously. Let there be a good budget for healthcare sector. Now, there should be, government should ensure that there is training and retraining of medical personnel, both in the public and in the private sectors.
Okay, thank you, Tony. Tony, I'm very sorry, I'll stop you. We are really constrained by time. As policymakers, now Nigeria is in recession. And usually want to think about how much does this bring. So this telemedicine we are talking about, what does it bring into the coffers? Does it have the potential of increasing our gross domestic product, GDP? Does it have the potential of helping Nigeria's economy out of recession? So can you quickly speak to that, then we round up?
Well, many, many ways. If this can even be a source of income for the government, as serious income, because the government is in the business of collecting taxes. When you enhance this technology, especially in this COVID era, when everybody is spending money on technology, the government can get money from the taxes collected from all the people, all the telemedicine companies, all the digital companies around. This can bring some revenue, serious revenue to the government if government wants to invest and make it better so that accessibility to internet, which is the basic raw material for telehealth, e-health, mobile health, the government can make a lot of money.
Okay. So what I take is if the tech infrastructure is provided and if the private players are encouraged, it has the potential of...
The tax revenue comes back to the government from all of that.
All right, that sounds good. So do I take that as your last words?
One thing that I want to say, telemedicine can even make it easy for any patient. If you want to even travel abroad, through the electronic health record attached to the telemedicine platform, you don't have to carry your medical report to travel with you. You can get to where you're going, log on to your e-health platform and download all your medical record and give it to your doctor.
And they could use it
via USB, or the doctor can go over it and makes things very much easier. Thank you for having us.
Thank you. Tony, your last word?
Okay. The government should look inward, you know, and help the efforts of Nigerians who are trying to make this change, especially in the medical field. So many have developed apps that could help, you know, improve the practice of medicine in Nigeria. Government has a role to, you know, bring up this. Sometimes there could be competitions, you know, on who can develop something that would help in an area. These are ways I think the government can aid health in Nigeria.
Okay, thank you very much. Government should support Nigerians who are coming up with tech solutions, and government should work with private sector and get all these work out. You know, you make reference to going abroad. We actually want a situation where those abroad will be consulting many of our strong health professionals back
Absolutely,
home.
it's possible.
It's something that, and when we say abroad, it could be anywhere.
Absolutely, yeah.
You know, so thank you so very much, Dr. Joseph Olowe.
Thanks for having us.
A doctor of physical therapy of over 30 years and the chief executive officer of Josmol Group. And thank you, Tony Amadi, for joining us on the program. He's ICT Lead at Make Our Hospital Work campaign, and also the founder of Kwikam mobile application. Thanks for being with us.
Thank you.
And to you, our viewers, we really thank you for being with us today. That's the much we can take, but we're going to continue conversation on ways that we can continue to improve access or make quality healthcare more accessible, affordable, and of course available to Nigerians. You know, in subsequent programs, we are going to be discussing other perspectives like health insurance and of course local manufacturing of health products and all that. Please stay safe, keep observing the protocols of COVID-19 and keep being healthy. My name is Dr Laz Eze, and bye for now.